Good morning, everyone. And first and foremost, as always, thank you to all the essential workers that are out there, to everyone doing what they should be doing. Thank you, thank you, thank you. But sadly enough, another Albany County resident has died from the virus, a woman in her 90s with multiple underlying conditions. My condolences to her family, my prayers, my love, and to the other 67 families. This brings us up to 68. So it's not an easy time, and like I have said yesterday and the day before, families have to say goodbye differently, and that's tough enough. And they can't be by their loved ones in their final minutes or final hours. So our prayers and thoughts go to you, and my condolences to all 68 families. As of today, there's 1,451 positive cases of the coronavirus. 852 people under mandatory quarantine and 6 people under precautionary quarantine. That's an increase of 26 positive cases since yesterday. The 852 stays the same, and the people under precautionary quarantine goes down by 10. (3,727) people have completed quarantine. Of those, 957 tested positive for the virus and have recovered. It's a difference of 21 today, recovery since yesterday. We now have 30 people in the hospital with a hospitalization rate of 2.06. Of those who have tested positive, yesterday the rate, like I said, was 2.03. 7 people currently in the ICU. Yesterday the number was 6, so we're up by 1. Over the last 5 days, there's been an average of 17.6 new positive cases each day. As you know, on the 14th, we were down to 12.4. I feel we're still down on we hit our apex and we're going the other way. But you have to remember, we're testing more aggressively than any place else in the state of New York, at different locations, to different areas of the county, in partnership with the surrounding counties. So quite honestly, I'm glad that the number isn't spiking up real high like it was a month ago. A reminder that our mobile site tests are by appointment only by calling area code 518-465-4771, area code 518-465-4771. And as always, the full schedule is posted on our website. You can go to our website to see the times and locations. Testing for essential workers, which we continue to get questions on, at the State of New York at UAlbany. You can call 1-888-364-3065, 1-888-364-3065, and you can go online. For the Colony site, as always, you need to register at Rite Aid. For the Priority 1 urgent care in Gilderland, same thing. For the antibody testing, as well as is being tested for the coronavirus. So I want to thank everyone that's been helping us move in the right direction and helping to continue to do the testing. But some good news, what I've been talking about. As we've been looking at an approach of reopening, how we can reopen, I kept saying, imagine what the workforce is going to be like, reimagine what restaurants and stores are going to look like, and what society as a whole is going to look like, finally, when we get the okay to open up. So I want to thank everyone in this region that worked with me on this. There were 7 out of the 8 that signed off and agreed to push this plan forward, and it was reviewed and pretty much approved by the control board yesterday. They liked our plan. They liked what we put in place. General Murphy had a lot of great comments. Everyone did, and I can't thank enough my team internally that worked so hard on this, everyone on my team in my office, and all the other counties that were involved in working with your supervisors there, working with your board of supervisors, and their workers to get this done. So I want to say this was a complete partnership effort to advance this forward. So I want to say a special thank you to Columbia, Greene, Rensselaer, Schenectady, Warren, Washington County. So thank you so much. It's a complex plan that combines creating a healthy environment for businesses with communications and best practice. To reopen, all businesses and employees will sign a pledge saying they understand what is being asked of them and committing to, so they can keep us open, safe, and healthy. There'll be an online portal so businesses can connect on anything from guidelines to grants and loans. That's been another big issue when we talk to small businesses, and I've said this before. I'm more worried about the small businesses than the big box stores that have deep pockets. We have to get these businesses up and running, and we have to be there to help them with the grants and loans, so that's one thing we did focus on. We'll follow best practice in CDC recommendations. We'll report all hospital numbers in the state system in our region control room, and we'll monitor the dashboard to make sure we stay in compliance. When it comes to public safety, we'll monitor our numbers of open hospital and ICU beds. We'll make sure everyone has a 90-day supply of PPE and keep testing for the COVID-19 with a priority of those with symptoms or have been exposed to a positive case to move forward. We can do this through the network of testing sites we've already established in the county. Other highlights of the plan include contact tracing done in each county, rapid response if increase or outbreak occurs. Business will protect high-risk employees with underlying conditions by encouraging remote work when possible or reassignment to another position. They must provide reusable or disposable masks, post signs about stopping the spread of the virus, enforce social distancing. High contact surfaces must be disinfected regularly, and employees must have adequate supplies of soap and hand sanitizers. Employees who are sick will be encouraged to stay home, and if someone is sick with the symptoms, employees need to separate them and send them home. Employees should ask employees questions daily before they enter the workplace. There'll be an industrial protocols, as I've mentioned before, like considering a 4-day work week or scattered shifts. Like I said, we have to be creative and reimagine. Employees can't not gather during breaks or for lunch. They must wear masks and social distance. Restaurants would be at 50% capacity and consider reservations when they open up. We're recommending through the CDC guidelines, no more buffet, salad bars, or self-serving drink fountains. And when we get to phase 4 with entertainment, the number of visitors would need to be limited. And talking about phase 4, when we talk about malls reopening, they would be in phase 4. And over the last week or so, I think I misspoke when I said that Paramount had filed for bankruptcy. The Paramount Management Company and the owner of Crossgates contacted my office. The company has not filed for bankruptcy, and it has no plan to do so. But when you look at the entertainment and churches and all that stuff that fall into that category, again, you're going to have to look at how the seating capacity is, how you're going to go forward. The cleaning frequency, deep cleaning of facilities would need to take place on a regular basis. And we will continue to work with the governor's office and organizations to come up with best protocols and procedures for schools to reopen. What about compliance is always a big question that we get. If we get a report of an incident, we may contact local authorities to respond. We believe it should be approved that we'll be able to open up shortly. So the plan goes more deeper into that. I just wanted to highlight some of the areas throughout the plan. I want to thank everyone. I mean, churches submitted a plan, everyone's, daycares, and I want to thank the press, especially, and to you. We got a lot of great response from a lot of companies that gave us their plan, and we submitted it part of this. A lot of thought went into this, a lot of effort went into this, and I have to say, now we're sharing it through NISAC and with other counties, and the other counties that shared their plan with us, we built off of their foundation too, so I want to thank them too, especially for sharing their plan with us, Ryan McManus and a few others, because we're in this together. And I've said this before, we're only going to get out of this together. We're only going to get through this together, leaning on each other and being the great New Yorkers we are. When we get hit at our hardest, we're at our best. And the only way that's going to happen is we continue to work in a partnership, forget about party affiliations, and just move forward. It's about opening up safely for the residents and making sure the safety and health of our residents and workers come first and foremost. I've said that before. I want to open up, but I can assure you if our matrix goes the other way, we will close down. We will take a step back if people are not paying attention. I drove by a construction site today on my way in, and I was surprised how many of the workers were together and they had no mask on. I don't want to call the site out, but I was totally amazed when I'm sitting in my car going, are you kidding me? And they're all on top of you. And we want the construction people back. We want you back working, but we want to keep you safe. And the only way we're going to keep you safe or the people around you is if you wear your mask. And I was just surprised. And again, you get, well, I'm with the same people. Yeah. But who are they with? So everyone you contact in this room, and I say this about Dr. Will and her team who do such a great job with tracing, well, you'd be surprised when you meet somebody and then they start talking and they start talking, and that person met 50 other people you had no idea they're in contact with. And that's how this spreads. So if we are going to open up, when we reopen up, especially the construction people that are getting out now, you have to wear a mask. I know no one wants to, but you have to. It's just not about your health. It's about the health of people around you. So think about the people around you, not about yourself. But talking about that, when this public health crisis started 10 weeks ago, the first thing I did was ask Dr. G. O'Donnell set up a mental health crisis hotline. And what made me think about it so quick is my time in the military and how we address it, being in family programs with soldiers and other ones. I said, we're going to need it, because if we're going to be in for long periods of time and the world's going to change around us, people need to reach out to somebody and ask questions. So, Dr. G did it very quickly. We did it for 8 days a week, or 7 days, I keep saying 8. 7 days a week, from 8 a.m. to 8 p.m., and I think so far we've taken over 250 calls. But the other thing we decided to do too, and I talked about it in my state of county, but we launched the Albany County Emergency Disaster Mental Health Response Team. Is an extension of our mobile health crisis team. Why is that so important? Because people are going through difficult times. People are going, unfortunately, you're seeing domestic violence go up, sexual assault go up, and you're seeing suicide rates go up, drug use go up, because people are home and now they're starting to go, things are happening to them. So we will be there to respond 7 days a week, 24 hours a day, to make sure we take care of our residents of this county. So I do want to thank Dr. G and Annette for doing all that, but Dr. G.
Good morning. Thank you, Mr. County Executive. It does feel like 8 days a week sometimes. I appreciate that. I'm glad to be back speaking with you all this morning. There are a couple of points that I wanted to make and elaborate a little bit on what the County Executive described. The context of this, I think, is worth mentioning that May is National Mental Health Recognition Month. That's important for a couple of reasons, and each year we recognize the courage of people who are working in the mental health field, people who are living with mental illness. We distribute information about the disorders. We try to raise awareness and decrease stigma about mental illness, but this year is different. We're not doing any events, we're not doing any gatherings, and I think the opportunity to mention this in public is important. 1 out of 5 people in this country over the course of their lifetime will experience what is considered a diagnosable mental health problem. There are more than 5 people in this room right now. I suspect that mental health related challenges have touched many of us in many different ways, and I wanted to recognize that and take this opportunity to announce some new initiatives that we're doing in the department. Would also like to say what I've mentioned at past visits here. The Albany County Department of Mental Health is open for business. We have been from day one. We've changed the way we do business, doing a lot of telehealth work, as you've probably heard from others. But the people in this county who have mental health challenges are being served. And what's notable about this is that this sustained crisis that we're experiencing is affecting those who have mental illness and oftentimes exacerbating that illness. But it's also affecting those folks who don't have mental illness, who are just struggling to deal with this sustained isolation, sustained uncertainty, and stress and worry and fear. And I've talked about that with you in the past. So Mental Health Awareness Month is important for us all to acknowledge and to recommit to the importance of emotional well-being amongst ourselves, amongst our loved ones. So, County Executive, we actually have an increase in calls from the last time I informed you of the numbers. We're up to about 275 calls to our mental health support line. And I think that reflects the need in the community and the fact that we're getting calls from outside of our community. The people have heard about this number and they're calling us, and our line has been staffed for 10 weeks, as you said. So we have expanded, though, in a couple of important ways. One is the Emergency Disaster Mental Health Response Team. We were charged early on to be prepared, and maybe this is your military training, but you told us a long time ago things don't go the way you expect, and you should be prepared for the worst. We've been working on developing our Emergency Disaster Mental Health Response Team for quite a while. We were about to launch it before this COVID pandemic started. I wanted to take a moment to formally acknowledge and recognize and explain to you what this is. This is an extension of our mobile crisis team. We've worked and trained alongside the Red Cross. We're one of the few counties in the nation, I've heard, that has developed their own mental health emergency response team. And essentially, leading up to this, we've participated with other agencies in the community when there have been major fires, supporting families. The team was assigned to man the support line right off the bat, and those are the folks, in addition to some community volunteers, who are on the line. But we're also trained in mass casualty events. And this is important because we've had more than 60 deaths in this county. God forbid, if we had a plane crash at the airport and there were 60 or more fatalities, our mental health disaster team would be deployed, and we'd set up a family support center, and we would work with families dealing with loss and grief. But this is so different. But it is also a mass casualty event. And our team, I'm announcing today, on our support line we are encouraging the families and loved ones of those who have lost people in this pandemic to make use of our support line and our virtual family support center. We can't set something up where you can come in, but we can do it over the phone. Our folks are trained in grief counseling. We'll be able to connect you to community resources as is needed. And I think this is a big value added to the services that we're doing here in the county. And also our emergency response team has recently, with the county executive's help, come into a large supply of cloth masks, which we're distributing to our mental health programs in the community. So I guess the bottom line is this is a good time to take pause and acknowledge the importance of our own self-care and emotional health, recognize the challenges that our loved ones and our neighbors have in this regard, know that our services are open and available, and that we are increasing those services to respond to the need in this county. And 3 months ago, I could never have predicted that we would have been talking about this, but I'm proud of what we've done as a department, as a county, to address the county's needs. So just wanted to give that update this morning.
Thank you to Dr. G, as always. And some other good things going on. Bruin Media yesterday had a parade around the building with signs at our Shaker Place in signs and dogs so the residents could see them from their windows. So thank you. They also donated N95 masks and cookies to Shaker Place staff. So thank you for everything that you've done. As always, as Dr. G has said, mental health support is available 7 days a week, 8 a.m. to 8 p.m. Area code 518-269-6634 as always. And our 24-hour sexual assault hotline number, area code 518-447-7716. And also our 211 in the New York State hotline. So I want to again say to the 68 families in Albany County, our condolences and prayers and heart go out to all of you in these difficult times, and we're here for you.